Welcome to a DEXIS Imprevo recommended scanning paths demonstration, designed specifically for clinical team members. In this fully animated guide, we'll walk through the 4 primary scan types performed with the Imprevo intraoral scanner: quadrant scans, anterior scans, full mouth scans, and buccal bite registrations. Quadrant scan, lower right quadrant. We'll begin with a quadrant scan of the lower right arch. Start by resting the scanner on the occlusal surface of the last molar. Glide the scanner from the molar toward the canine, maintaining light, continuous contact with the occlusal surfaces. At the canine, rotate the scanner 45 degrees toward the lingual and scan from canine back to molar, keeping light contact along the lingual surfaces. Next, glide the scanner over the occlusal surface and angle 45 degrees toward the buccal, scanning from molar to canine. Press the mode button to select the opposing arch and repeat this same recommended scanning path. Glide the scanner from the molar toward the canine, maintaining light, continuous contact with the occlusal surfaces. At the canine, rotate the scanner 45 degrees toward the lingual and scan from canine back to molar, keeping light contact along the lingual surfaces. Next, glide the scanner over the occlusal surface and angle 45 degrees toward the buccal, scanning from molar to canine. Anterior scan. Begin on the lower arch. Place the scanner on the facial surface of the canine, then glide from facial over the incisal edge to the lingual surface. Move to the lateral and repeat the same motion, lingual over the incisal to the facial. Continue this zigzag pattern until all anterior teeth are captured. Press the mode button to select the opposing arch and follow the same recommended scanning pattern. Full mouth scan. Begin on the lower right arch. Place the scanner on the occlusal surface of the last molar and glide forward to the canine, keeping light occlusal contact. At the canine, rotate 45 degrees lingually and scan back toward the molar. Move over the occlusal surfaces to the buccal, maintaining a 45-degree buccal angle as you scan from molar to canine. At the canine, transition from facial over the incisal to the lingual. Slide to the lateral and repeat. Lingual over the incisal to the facial. Continue this anterior zigzag pattern until all front teeth are scanned. Now complete the remaining posterior region. Begin at the first premolar, resting the scanner on the occlusal surface. Scan from the premolar to the last molar, maintaining light contact. Rotate the scanner 45 degrees lingually and scan back toward the canine. Then glide over the cusp tip of the canine and scan the buccal surfaces from canine to the last molar. Press the mode button to select the opposing arch and follow the same recommended scanning pattern. Place the scanner on the occlusal surface of the last molar and glide forward to the canine, keeping light occlusal contact. At the canine, rotate 45 degrees lingually and scan back toward the molar. Move over the occlusal surfaces to the buccal, maintaining a 45-degree buccal angle as you scan from molar to canine. At the canine, transition from facial over the incisal to the lingual. Slide to the lateral and repeat. Lingual over the incisal to the facial. Continue this anterior zigzag pattern until all front teeth are scanned. Now complete the remaining posterior region. Begin at the first premolar, resting the scanner on the occlusal surface. Scan from the premolar to the last molar, maintaining light contact. Rotate the scanner 45 degrees lingually and scan back toward the canine. Then glide over the cusp tip of the canine and scan the buccal surfaces from canine to the last molar. Buccal bite registration. Partial arch, prepped tooth. To capture a partial arch buccal bite on a patient with a prepped tooth at number 30, have the patient open, then place the scanner between the cheek and buccal surfaces. Rest the scanner on the buccal surface of the maxillary molar and slowly glide up and down past the gingival margins of both arches. Avoid any mesial or distal movement. Carefully remove the scanner from the patient's mouth and wait for the occlusion gallery to display the captured bite. Repeat this capture process at 2 more locations relative to the prepped tooth. 1. Directly at the site of the prep. 2. Mesial to the prep. For each capture, gently glide the scanner up and down until the bite is recognized. Then remove the scanner and wait for the image to appear in the occlusion gallery. Buccal bite registration. Full mouth scan. For a full mouth scan, press the mode button to select buccal bite. We'll begin on the right molar region. Have the patient open their mouth and insert the scanner between the cheek and buccal surfaces. Have the patient bite in occlusion. Place the scanner on the maxillary molar buccal surface and glide up and down past the gingival margins, keeping gentle contact with the teeth. Avoid mesial or distal movement. When the bite is captured, remove the scanner and wait for the occlusion gallery to display it. Next, repeat the process at the first premolar canine region. Scan up and down until recognition occurs, then remove the scanner and wait for the capture to appear. Repeat the same steps on the patient's left side. Place the scanner on the maxillary molar buccal surface and glide up and down past the gingival margins, keeping gentle contact with the teeth. Next, repeat the process at the first premolar canine region. Scan up and down until recognition occurs. This concludes the DEXIS Imprevo recommended scanning paths animated demonstration. Thank you for watching. For additional resources and more DEXIS clinical educational videos, please visit the How To Videos section at DEXIS.com.